Welcome back to Good Morning Indiana. Every day, thousands of Hoosiers receive a text in the fight against the global health crisis we know as COVID-19, this pandemic. The texting system is easy to use, but it's also voluntary, which means some people may never connect with the information or services that they need. Michelle Waddell had jollier days before the start of the new year. She briefly turned over operation of her curbside food pantry to volunteers when she got COVID.
Yeah, I ended up feeling really poorly there for several days, but we all got better. There were so many community members and friends who just jumped in and organized and cleaned the pantry and the front porch. It was actually really awesome.
Thousands of Hoosiers, Michelle received a daily text from the State Department of Health to check on her quarantining and her health. The voluntary texts ask basic questions, including, can you self-quarantine? Do you have symptoms? Do you feel safe in your current situation?
Not intrusive. You could tell that they just wanted to know some very specific information, and that was it. It just took a couple of minutes so they could collect all the data that they need to try to mitigate this virus.
Here's a snapshot of the contact tracing done by the state's texting system. From January the 3rd through the 30th, 99,042 Hoosiers tested positive for the virus. They received a text, as did nearly 107,000 people who came in close contact with them during that same time period. Thousands more would have been alerted, but only 60% of the people who tested positive for COVID-19 in January actually shared close contact information with the state.
If you don't respond to the text, we continue to try to reach you on the phone. If they're not engaging with us, we just don't know. We don't know if they are abiding by isolation or quarantine guidance. It's now up to them.
If I could not have isolated in my home, or if there were barriers, how would you have helped me? What resources are available to people who may be unable to isolate?
We also work closely with our local health departments on those more urgent needs, because again, based upon the specific services available to you in your kind of county or where you live.
Some folks are going to say, look, I'm hearing about Moderna, I'm hearing about Pfizer, I'm hearing about Johnson & Johnson. Why do I need to engage in contact tracing if the vaccine rollout is already underway?
Yes, cases are down, but there's still a lot of spread happening. Also, we know there are variants that have started coming into the nation and have started coming into our state. So we need to stay diligent to do our part in controlling any additional spread of the virus until we can get to that herd immunity.
In the meantime, the daily texts tackle the top health concern of the day. On a personal note, I was notified several weeks ago that I came in contact with someone who tested positive, so I chose to use the voluntary system. The only personal information that was collected, my name, my age, and race. It was quick, it was easy to use, and the text kept coming every day until my quarantine period was over. So if you get the text, please respond. Lauren?